Hello and welcome. Today we're diving deep into a common yet often misunderstood condition, enteritis. This is an inflammation of the small intestine that can cause a range of uncomfortable symptoms. Join us as we explore its causes, effects, diagnosis, and management. So, what exactly causes enteritis? Well, the culprit is usually an infection. Viruses like norovirus and rotavirus are frequent offenders, leading to viral enteritis, commonly known as the stomach flu. Bacteria such as Salmonella, E. coli, and Campylobacter can also trigger enteritis, especially through contaminated food or water. Parasites like Giardia can also be responsible. Less commonly, enteritis can be caused by certain medications, radiation therapy, or underlying inflammatory conditions like Crohn's disease. Let's break down what's happening inside your body during enteritis. When the small intestine becomes inflamed, its ability to properly absorb nutrients and fluids is compromised. This inflammation disrupts the normal processes of digestion and absorption. This disruption leads to increased fluid secretion into the intestines and decreased absorption, resulting in diarrhea. The irritated intestinal lining can also cause abdominal pain and cramping. In severe cases, the inflammation can even lead to ulceration and bleeding. Enteritis is a widespread condition, affecting people of all ages and backgrounds. Viral enteritis is particularly common during colder months, often spreading rapidly in crowded environments like schools and nursing homes. Bacterial enteritis is frequently associated with foodborne outbreaks, making food safety practices crucial. The global burden of enteritis is significant, especially in developing countries where access to clean water and sanitation is limited. The symptoms of enteritis can vary depending on the cause and severity of the inflammation. However, some common signs include diarrhea, which can be watery or bloody, abdominal pain and cramping, nausea, vomiting, loss of appetite, and a general feeling of malaise. You might also experience fever, chills, and muscle aches. Dehydration is a serious concern, especially in young children and the elderly. If you suspect you have enteritis, it's essential to pay attention to these symptoms and seek medical advice if they are severe or persistent. Diagnosing enteritis typically involves a thorough medical history and physical examination. Your doctor will ask about your symptoms, recent travel, and potential exposure to contaminated food or water. A stool sample may be collected to identify the specific bacteria, virus, or parasite causing the infection. In some cases, blood tests might be ordered to check for signs of inflammation or dehydration. In rare cases, a colonoscopy or endoscopy may be performed to visualize the lining of the intestines and obtain biopsies for further analysis. While the general term enteritis encompasses inflammation of the small intestine, it's helpful to understand a few specific types. Gastroenteritis refers to inflammation of both the stomach and small intestine. Food poisoning often leads to a form of acute bacterial or viral enteritis. Regional enteritis is an older term that refers to Crohn's disease, a chronic inflammatory bowel disease that can affect any part of the digestive tract, including the small intestine. Treatment for enteritis focuses on managing symptoms and preventing complications. Hydration is paramount, so drinking plenty of clear fluids like water, broth, and electrolyte solutions is crucial. Over-the-counter medications like loperamide, Imodium, or bismuth subsalicylate Pepto-Bismol can help relieve diarrhea, but they should be used with caution and under the guidance of a healthcare professional. Antibiotics are only necessary for bacterial infections and should not be used for viral enteritis. Probiotics may help restore the balance of gut bacteria and shorten the duration of symptoms. In severe cases, hospitalization and intravenous fluids may be required. Preventing enteritis involves practicing good hygiene and food safety. Wash your hands frequently with soap and water, especially before eating and after using the restroom. Cook food thoroughly to kill harmful bacteria, and avoid cross-contamination by keeping raw and cooked foods separate. Store food properly at appropriate temperatures. Drink only safe, treated water. When traveling to areas with poor sanitation, be extra cautious about what you eat and drink. Consider getting vaccinated against rotavirus, especially for infants. The prognosis for enteritis is generally good, especially with prompt and appropriate treatment. Most cases resolve within a few days to a week. However, complications such as dehydration, electrolyte imbalances, and kidney failure can occur, particularly in vulnerable populations. Ongoing research is exploring new ways to diagnose and treat enteritis, including the development of more effective antiviral medications and targeted therapies for inflammatory bowel diseases. Studies are also investigating the role of the gut microbiome in preventing and managing enteritis. By staying informed and proactive, we can better protect ourselves and our communities from the impact of this common ailment. Thank you for watching.